Immunizations and vaccines are a global epidemic seen around our world and for over a century. Over the years, we have seen vaccines take on harmful diseases, including cervical cancer, diphtheria, hepatitis B, measles, mumps, pertussis, pneumonia, polio, rotavirus, rubella, and tetanus. Childhood vaccines have proven to be one of the most effective public health strategies to control and prevent diseases.
But as I said, this is a story about risk. So let's actually compare the risks of the disease versus the vaccine. Let's take this front row right here, 20 people. Let's give them measles, sorry. With that, we would expect 2 people to have ear infection, 2 people to have diarrhea, and 1 person to have pneumonia, which I might add is one of the deadliest complications of measles. Now, if we swap that out for 20 people with the measles, mumps, rubella vaccine, we'd expect to have just over 3 people with a fever and 1 with a mild rash. Getting back to the disease, if we scale that population out to 1,000 people, we'd expect to also find 1 person with encephalitis, or swelling of the brain tissues, which can have severe permanent damage, and 1 to 2 people would die. However, we have to scale the population out to 1 million vaccinations to see 1 severe reaction. Now, perhaps you're willing to roll the dice, perhaps you're willing to take that chance. And the problem is, while this is a personal decision, it affects other people. Vaccinations work based on herd immunity. When the population is not vaccinated, disease spreads rapidly through a community. When only part of a community is vaccinated, that disease still spreads very easily. However, when most of a population is vaccinated, we can contain that disease. In the case of measles, that number is 95%. 95% of the population would need to be vaccinated to contain measles.
In order to maintain herd immunity, we must increase the global vaccination coverage from 85%. Increasing it just a little could save 1.5 million deaths from occurring every year. An estimate of 19.9 million children under the age of 1 did not receive the DTP3 vaccine. Also, by 2017, 85% of infants received the DPT3. 116.2 million infants in 123 countries have reached at least 90% coverage. However, with that being said, more than 30 million children are unimmunized every year, either because vaccines are unavailable, health services are poorly provided, or inaccessible. Families are uninformed or misinformed about when and if they can bring their children in for immunization. There are many ways to fix immunization, and there are many countries and organizations out to make a difference. Just some ways that we can increase and encourage the immunization to prosper is encourage governments and leaderships to nationally show immunization programs, improve monitoring and surveillance on the immunization itself to make sure that people who are non-accessible are receiving help. Expand immunization, mobilize domestic finances, strengthen international corporations, and increase the knowledge of how important it is to immunize every year. On a local level, we can encourage patient counseling, combining vaccines or not combining vaccines as the patients would like, improving the access and payment methods, and medical records. Maximum patient office visits are so important to keep vaccines going. Here are just a few examples of 15 countries that vaccinate and how differently the vaccinations differ from each country. Italy, Canada, the United States, Britain, Switzerland, Sweden, Australia, Germany, and France all do not have mandatory laws to vaccinate. Neither do they require you to vaccinate before your child enters school. However, the United States, since it is made up of 50 states, each state has its own regulation. Nigeria, Madagascar, and Ukraine are lower and poor populations that aren't able to fund the necessary needs to vaccinate all of their population. Japan, however, has decided that there is a need to ban the MMR vaccine and refuses to take the ban off no matter what research is provided, given that the MMR vaccine does not cause harm. Africa holds a big stage in the immunization world due to its malnourishment, unsanitary, and crowded conditions that most of the population has to live in. The measles death toll is so high that every minute one child dies. Many of the mothers don't even name their children until after they survive the disease. 2001 tetanus, known as in the Old Testament the seventh-day death, killed an estimate of 200,000 newborns and 30,000 mothers. From Africa to the United States, the battle is starting between vaccinating and not vaccinating your child. The more children that remain unvaccinated, the more disease we will see spread. We must protect those who cannot protect themselves.
Ran a story where we heard a parent say she does not trust these vaccines. Particularly there's a lot of mistrust when it comes to the MMR vaccine. What do you say to a parent like that? She's obviously in the minority, she's an outlier, but in some of these communities, there are enough parents that think this way that we have now an outbreak of the measles.
Well, first of all, you don't want to denigrate or criticize the parent for their thoughts and for their beliefs, but you have to tell them something that's quite true, that the overwhelming scientific evidence over many, many years and decades indicate that the vaccine, that particularly the measles vaccine, which what we're talking about today, is very safe. Now, the lack of safety and the adverse events, things like autism, which people talk about, that issue is based purely on fabrication, and that's been proven. There is no association whatsoever between the measles vaccine and autism because a physician in the 90s back in the UK made some fraudulent statements based on data that was fraudulent data, that in fact there was an association. That got out into the internet, as it were, and never left. And then there's this feeling, I guess understandably, but unfortunately not based on scientific data, that the vaccines are not safe. Particularly with measles, it's unfortunate because measles is not a trivial disease. When measles was rampant before the vaccines were available, it was one of the most devastating diseases globally and in the United States. Prior to the 1960s, when the vaccine was introduced, there were a couple of million cases of measles, 400 to 500 deaths, about 500 deaths a year, thousands and thousands of hospitalizations, and 1,000 cases of encephalitis.
So listen, Doctor, her comeback to this idea of all these studies being done is that, essentially not the right studies. They're not looking.
No, that's not true. That's just not true. I mean, I'm sorry. I don't mean to disrespect the person that's saying that, but that's just not true, period.
All right. So listen, officially the disease was declared eliminated in 2000. Obviously, we've had these recent outbreaks. Do we blame the anti-vax movement for that?
Well, yes, unfortunately, you don't want to say blame. That's a pejorative thing, but it as a result of the anti-vax movement. If you look at the outbreaks, the outbreak in Disneyland years ago, the outbreak in Minnesota among the Somali population, the current outbreak that's going on in New York City and in Rockland County in New York State among Hasidic Jews, and what we're seeing now in Washington State are due to individuals, families, parents not having their children be vaccinated. And when you get below a certain level of vaccination in the community, that's how you get outbreaks. That's been scientifically proven year after year. So the answer to your question, unfortunately, is correct.